The United States versus Swedish healthcare system comparison. Even though both the United States and Sweden are comparatively wealthy states, there are considerable differences between the approaches adopted towards healthcare in Sweden and the US, which can be traced by comparing the statistical data for each state with the help of multinational comparisons of health systems data. To start with, in the USA, more money is spent annually per capita on healthcare and related issues than in Sweden, with $8,233 as opposed to $3,758. As a part of GDP, healthcare spending in the US also leaves Sweden far behind, with 17.6% versus 9.6%. When it comes to healthcare spending per capita in relation to the source of funding, the Swedish healthcare system comes as a close second after the USA, with $8,233 in the USA, versus $5,269 in Sweden. As for pharmaceutical spending, the USA also takes first place, $983, while Sweden seems to be on the opposite side of the scale, $474. When it comes to healthcare supply and utilization, the differences between the two states become more obvious. In 2010, hospital discharges in Sweden made 163 people in 1 year, while in the United States, 240 people were discharged in 1 year. The given difference, however, can also be attributed to the gap between the US and Sweden populations, 308,745,538 and 9,500,000 people correspondingly. Both Swedes and Americans prefer not to stay in hospitals for too long, 4.7 and 5 days correspondingly, visit physicians very often, 3.8 visits in the US and 2.9 visits in Sweden made annually, and have quite a few acute hospital beds, average of 2 in the US and 2.6 in Sweden. However, in contrast to Sweden, US healthcare has almost 1.5 times fewer practicing physicians, 2.6 per 1,000 people compared to 3.8 in Sweden, and 1.5 times fewer inpatient coronary bypass procedures, 76 versus 43. In terms of health promotion and disease prevention, the differences are not that drastic. 64% of the US adult population and 63.9% of adults in Sweden received flu immunization in 2010. Both states also have the least number of reported smoking adults, 15.1 for the US and 14 for Sweden. In contrast, for Sweden though, 12.9% of obesity seems a basic health concern, and for US residents, 39.5%. Speaking of services quality and patient safety, death rates in Sweden make 61 per 100,000 people, which is 36% lower than in the US. However, if comparing the changes in the death rates, Sweden has progressed by 45% compared to the US over the past decade. There are more breast cancer survivors in the US than in Sweden, 86% versus 83.3%. The diabetes amputation rates are comparatively higher in the US, 33.7 versus 5.7 in Sweden. As for in-hospital mortality, both Sweden and the USA show quite low scores, 2.9 and 4.3. Swedish surgeons tend to forget foreign objects in their patients' bodies less often, 2.6 versus 4.9 in the USA, and their surgeries result in 151 cases of sepsis, less than in the United States. Last, but not least, the financial aspect seems to be less complicated in Sweden than it is in the USA. Hospital spending per discharge is at the highest rate in the United States at $19,319, while Sweden's population spends approximately $9,990 per discharge annually. With that being said, it can be assumed that the US healthcare system is less flexible than the one in Sweden. However, it is also worth noting that in the United States, rates of diabetes and mortality are considerably higher, which can probably be attributed to the lack of awareness of the issue.